Hi everyone, welcome back to Beyond Your Knowledge. So today we are going to be studying the treatment for gout, and before we continue I would like to share this with you. And it says, honor all people, love the brotherhood, fear God, honor the king, and also be thankful to the Lord, which is Psalm 136 1 to 3, so you can read it if you would like. So but to continue here with the treatment for gout, so I would like that we had to split it in these two ways. So first we are going to see if it's for acute or if it's for chronic. Okay, so if it's for acute, we need to look for the current treatment and for the most effective treatment. And so let's just start with the first one, which is the current one, which is I think the one that probably we should know very well. The current one, and the current one we are going to give to the patient indomethacin. And in indomethacin, it is an reversible excuse me, it is a reversible inhibitor of COX-1 and COX-2, okay, of COX-1 and COX-2. Now this is indomethacin, okay. Now, but what about if the patient cannot has this one because it's not that effective? So we can go to the most effective one, and this one, the most effective, is called colchicine. And then colchicine, it is going to work blocking your microtubules, and then so blocking the microtubules and the so that means that, I mean, when you block your microtubules, so therefore you're going to be blocking so all the rapid dividing cells, okay. And I would like just to rapid dividing cells. Also, I would like to show you a picture of the microtubules, but before I show you the picture of the microtubules, so examples of the rapid dividing cells. The rapid dividing cells are, for example, your skin, your hair, your nails, your GI system, all of those. Now, when you block the microtubules, so here it is the picture. So this is the picture of the microtubules. The microtubules are blocked with colchicine, okay. And then when that's happened, that should cause relief to the patient. But why? So because it's going to avoid or another way. So because the microtubules, the purpose of the microtubules, we need those for the process of mitosis. Now if you are not doing mitosis, which means that there is a mitosis, so before, so microtubules are needed for mitosis, okay. And now mitosis, remember that mitosis is when there is a cell division that results in two daughter cells, each having the same number and kind of chromosome as the parent nucleus, typical of ordinary tissue growth. So for example, you have a you're going to have a cell division. So let's just say you have this cell here, and then you're going to have, there is a division, and then you're going to have two identical cells. And those two identical cells, that one doesn't look identical, but yeah, so you have two identical cells, let's just with the same quantity of chromosome, okay, the same quantity of chromosomes. And this is basically the mitosis, and microtubules are involved in the process. But when you give to the patient colchicine, so block that process. Well, so now if the patient has a chronic or recurrent gout, so we can say chronic here, or or recurrent gout. So which kind of medicine or drug we're going to give to him? So it's called allopurinol, is one of those. Okay, so we're going to give to the patient allopurinol. In the way that I learned this is because so it's all, like all the time. So oh doctor, I have pain all the time, I have gout all the time, so I can give you allopurinol. Okay, and but how does allopurinol works? So allopurinol is going to block one enzyme, and this enzyme is called something oxidase. Okay, so if you block your enzyme something oxidase, so with allopurinol that should help as well. Now also another drug that we can give to the patient is called probenecid. Okay, so probenecid probably sounds fun or something. It's just probenecid. I just can spell it just instead of B, so probenecid. Okay, and then they have the word proof here, so and then prove me that the pain can goes away, and then I don't know, I just do just like this. And yeah, with the probenecid, just prove me that the pain can goes away. So this is another way to that I just remember. And but yeah, probenecid, how does probenecid works? So probenecid is going to increase your excretion of uric acid. So because remember that the patient has uric acid in the toe, for example, and then if you increase this uric acid excretion, so by blocking by blocking the reabsorption of uric acid, that can help as well. Okay, so you increase your uric acid by blocking the reabsorption of what? Of the same uric acid. Okay, now all those things work, but what about if the patient has a renal failure? So let's just see, what about in case of renal failure? So in case of renal failure, we cannot use the one that we used before, which is for example indomethacin. So it's not indomethacin, it's contraindicated. Allopurinol, I think, yeah, also yeah. So basically those are contraindicated. But what we're going to use for the renal failure, so for the renal failure we are going to inject. So we're going to get a needle here. So you get a needle here, the patient. So you get a needle, and then you're going to inject IV steroids. Okay, so you're going to inject IV steroids because the colchicine that we mentioned before. So because the colchicine, which is the one that is the most effective, so the colchicine or indomethacin, this is one that you're mentioning here, so both are renally excreted. For this reason, those are not allowed, so they are contraindicated. So we need to help the patient. So what we're going to do, so we're going to give to the patient IV steroid. Okay, but this IV steroid should be locally. Okay, locally. So IV steroid locally, and I think so with that, with we can help the patients. Now as I will give you some hints. Those are no hints, so some advices. So for example, the patient, if you have high levels of uric acid, so you want to avoid more uric acid. So we already know that the red meat increase your uric acid. Okay, increase your uric acid. Now what would you recommend to the patient? So better is to stop with the red meat. Okay, and probably in the USMLE they will ask this about nutrition or all those things in this topic, but we as a doctors, we need to give to the patients as treat or alternatives that doesn't be that be better, or so that be more flexible or more easy to work with that. and that cause less side effects. So basically this is the word. So we want to give to the patient a quality life, and because we want to give to the patient a quality life, so we need to use also, I recommend that we give to the patient those orientation. Well, I think that we are almost done with this, and remember that if you have any question, you can write a comment over there. And thank you so much, and God bless you.